Hello and welcome to the ChildSafe podcast series. In this edition, we discuss poison and poison ingestion in children. This podcast series is launched under the banner of the Imagine a World campaign recently introduced by ChildSafe. Imagine a World seeks to draw contrast between the ideal world and the stark reality and risks that children face on a daily basis. As you engage with the content in this video, I would very much like for you to imagine a scenario where you, as a parent, a caregiver, a school principal, or any person charged with the responsibility of minding a child, to create a scenario where you've turned your back for just a second. Maybe you've gone to pack away the laundry. Maybe you've just gone to fetch something from the car, and suddenly a bone-chilling scream comes from either the garage, the bedroom, the kitchen, or anywhere within the house. What is your first reaction? What do you do? Who do you call? Speaking to the author of Thinking Fast and Slow, Anil Kahneman won the Nobel Prize for showing that we are not always as rational as we believe ourselves to be. And certainly, there is also research that shows that we are more likely to accept information as true and correct when that information is passed to us from reference groups such as family and friends. And basically, here we have to look at a potential moment of truth, and here to walk us through what to do and what not to do when a child would engage in poisons and possibly ingest it. We have our subject matter expert, Dr. Cindy Stephan, who is a medical doctor and director at the Red Cross Children's Hospital Poisons Information Center. She's been a doctor for a very long time, and she has a special interest in clinical toxicology and its impact on pediatrics and child health. So she is also particularly interested in pesticide poisoning, environmental toxins, animal bites and stings, and preventable poison exposures, especially in children. So, Doctor, we are honored to have you on board. Thank you so much for making the time and for sharing your experience and expertise with us. And I would like us to start off today with gratitude and thanking you and the first responders and all the clinicians and support staff for doing the phenomenal work that you do, the lives that you change, and the lives that you save every day. Welcome.
Thank you so much. Thank you, Shane. And thanks for the opportunity to talk about poisoning, and especially in children. Appreciate the opportunity to do this.
Wonderful. So the theme of poisons came up as a communications person. I found myself entering a space where I wanted to take pictures of a training that was taking place. And it was a training that was presented by a medical officer from the Poison Information Center. And I found myself sitting down and engaging with the content that was being presented. And with the scenario that I've created before, as we lead it into this, what happened is that many of the things that were brought to the fore and that was discussed and translated in this training challenged some of the beliefs that I held. And I think it was quite a sobering engagement as I engaged with this doctor on some of the things that we might have heard from a grandmother, things we might have heard from our mother. That's why I asked the question, who do you contact when something like this happens in your home? And so the issue around inducing vomiting or giving a child milk when they have ingested, a certain thing could potentially be very dangerous. It could, impede or the immediate or the midterm health outcomes of that particular patient. Maybe you can tell us a little bit more about what kind of poisons is common in the house, and then lead into why we should never engage in giving them or inducing the vomiting and the milk.
Thank you. Thanks, Shane. So the most common poison, in fact, in the house, and I think we're going to really focus mainly on children today, are in fact medications. So almost half of our inquiries that we get on the poison helpline service that we run are about children getting hold of people's tablets that haven't been put away, that are kept in handbags or next to the bed, or etc. So that is really our biggest group. The second group are the pesticides. So especially in these hot summer months, there are more pests around, and people use pesticides, leave rat poisons down with food on the floor. That's a common way that children can ingest a pesticide, or the mosquito sprays and repellents that are around and within reach of children. And then the third group really are the household cleaning chemicals that we also sometimes forget to be sure are locked away out of reach of children. So those are our big main groups. Of course, there are, especially in the summer months, the issues of spider bites and scorpion stings and snake bites, depending on where you live. And sea creatures can also cause stings when families are going to the beach in these nice summer days. So that's another group of possible poisonings for children. In terms of what you said about vomiting, that was the standard of care. But 30, 40 years ago, we did believe that vomiting was a good thing to do for anyone who'd taken a poison. Yeah. But we now know that it is not. And in fact, it does not, it's not very effective. A lot of the poison remains in the stomach, so there's not much use in inducing vomiting. Mm-hmm. And certainly for children, one can cause harm, both in the process of forcing them to vomit and depending on what they swallowed. Because if they swallowed something like a drain cleaner, for example, it causes a chemical burn in the mouth and the throat and in the esophagus. And then you force them to vomit, and this comes again and does a second round of causing a chemical burn. So depending on the substance, vomiting can be very harmful. But even if the vomiting itself is not harmful, it does not do any good. And so one risks injuring the child in the process of forcing vomiting. So we never, ever recommend inducing vomiting now. The second thing about milk, because a lot of people love to give milk, and I think we believe, as you say, we've inherited from our family, this is the right thing to do. But again, unfortunately, it isn't, for a few reasons. One is that a lot of milk given to a child might cause them to vomit, makes them nauseous, and they vomit. Right. So we're back to, we don't want them to vomit, so we don't want to give a lot of milk. Secondly, for some particular medications or pesticides, and I think particularly here of mothballs, those little mothballs that we put in the cupboards to keep the moths away. If a child has swallowed one of those and then drinks milk, the milk actually increases the absorption of that mothball in the stomach because of the fat content in the milk. Right. So in that case, it actually makes it worse. So we recommend water, a little bit of water, if the child would like, but we don't need to force the child to drink anything unless they have a horrible taste in the mouth or would like to rinse their mouth or have something to drink. Right. So water is the safest option. Definitely not milk, and please never vomiting. That's definitely a no-no in these days of treating poisoning.
Right. You've mentioned such a crucial thing that I think for the normal layperson, not thinking like a doctor and not realizing that many of these substances have complex compounds and active ingredients, some more than one, that could react with something that you give the child. So that leaves us with a conundrum. Let's say that an incident occurs and the child is in pain. Let's say it was a corrosive agent. What do we do to alleviate that child's pain? How do we calm them down?
I'm glad you mentioned that, because it's so easy. And again, on our poison line, and I'll give you the details of that resource because it's available to everybody to use. often one reacts with fear, with anxiety, even anger. One's angry with the child for doing this. So this all makes one's response often very emotional. And it, of course, is not helpful for a child. So if one can possibly harness one's calm in responding in this kind of situation, it actually helps the child. Whereas if they see their caregivers panicking, it just makes it worse. That corrosive ingestion is probably the worst and most difficult to deal with in a child. Importantly, one needs to rinse off whatever corrosive product it was. So like a drain cleaner, one needs to flush the mouth, the skin, wherever it's fallen, with as much water as possible. For quite a while, we recommend 15 to 20 minutes in a shower, actually, as a first aid response, to rinse as much of that off. It is painful, and so it's very difficult at that point to give the child something to take for pain, like paracetamol syrup or something, because we don't want them to swallow. We don't know, is there a burn? Is there a perforation, a hole in the esophagus? So we don't actually want to give them anything, just to rinse. And in that case, the most important thing is to get to the hospital as soon as possible, where they can have a drip, they can have a pain relief given to them that way. So in a caustic or a chemical burn, get to your local emergency department as soon as possible.
Right.
But that is not common. That is not the most common by any means in terms of poisoning that children are exposed to.
So that being the worst case scenario that could potentially happen, and you have classed the different types of poisons. If we had to step it one down and come to something that's more common, like say dishwashing liquid, for example, or turpentine, or something that's more accessible under normal circumstances, what do we do in instances where that is concerned?
Yeah, thank you. And that is much more common, as you say. I was on call last night on the poison helpline. I had a couple of calls exactly like that. Child in the garage picks up the bottle of Terps, is found drinking it. So the first thing to do is, again, to remain calm, rinse any of this product off the child, rinse the mouth. And then probably the next most important thing to do is to call the poison helpline. It's a service that's available to anybody in the country, even beyond our borders, actually, on a 24-hour basis every day of the year. I'll give you the number. It's 0861 555 777. And get through to that number. We can then advise you how to watch your child. Most probably we'll say, watch the child at home and let's see what happens. Particularly in the case of Terps, if the child is vomiting spontaneously, not because you made them vomit, spontaneously, or if they are coughing or have any breathing difficulties, we will say, rather go to hospital, let the child be monitored there. But if the child is well, plain eating, doesn't seem in any stress, then we will say, monitor the child, watch the child at home for 4 or 6 hours. If the child remains well, you don't need to do anything further. And so in that way, the poison helpline can prevent an unnecessary visit to hospital. Hospitals are busy. I mean, who wants to spend time waiting in a hospital if you don't need to? So that's where the poison helpline can really assist parents and caregivers to advise in those less serious exposures what would be the best to do.
So in order to fast track the triage and the sign in at the hospital in a worst case scenario, what type of information should this caregiver have handy, like jotted down, in terms of being able to assist the doctor?
I mean, that's a great question, because as you've indicated, if we know what it is the child has taken, we are so much better able to help. So ideally, take with it. I mean, don't leave it at home. Take with you whatever it was the child has swallowed, be it the bottle of Terps or the medication packet or container or box, whatever it is, take it with you. If that's impossible, take a photo. I think so many of us have cell phones, so we can easily take a photo. So take a photo, but preferably bring the whole packet, because often on the back of the packet, we'll find information that will help us. So if you just take a picture of the front, that might not be enough. I mean, one of the nice things, in inverted commas, about poisoning and arriving at an emergency department is that patients with poisoning get triaged a particular color. In an emergency department, red is the most urgent. The patient must be seen immediately. The next color is orange, and the patient should be seen within about 10 minutes. And poisoning is an orange category for triage at any emergency department. Right. I mean, obviously, some hospitals, if they're overwhelmed, might not make the 10 minutes for an orange triage case, but poisoning, and especially in children, you will tend to find gets fast-tracked through in an emergency department of hospitals.
So information then, like what did the child consume, when, the time that they consumed it,
absolutely,
how much of it they consumed, and if, so have they displayed any specific symptoms or something that could aid the hospital staff and doctors to also get to the decisions faster. So what are the typical symptoms if we now move away from the house cleaning and more towards the medications, common medications, as you said, that is found in bedside drawers, handbags, and those kind of things. Most parents are attuned to children when they go quiet, something is not right. There's almost like a step-by-step process that one needs to go through to monitor or to recognize the signs that a child may have ingested medications. Maybe you can walk us through some of those symptoms that they can see within the pills.
Yeah. So as you say, often when a child goes quiet, you worry. And those are the children where the caregivers pick up quite quickly that they've taken something. Often early on in the first half hour, there's nothing. You don't know that the child's taken anything. And that's a good time to phone us on our poison helpline. Because if you know how many tablets are missing or what's been taken, we can advise what is the next step. But if you didn't hear your child go quiet, so you're not even aware the child's taken anything, one of the telltale signs for children is drowsiness. So your child is surprisingly drowsy and falling asleep, off balance, not able to walk straight. Immediately you must think, have they got hold of any medication? So commonly drowsiness, extreme sleepiness are some of the signs of a medication overdose. Other signs would be vomiting, diarrhea, and that could be more a pesticide poisoning can cause those things. A lot of sweating, or they're drooling, a lot of saliva is coming out of their mouth. Those kind of symptoms are often related to pesticide that you didn't know the child got hold of. But essentially, those are the things, particularly drowsiness, vomiting for medications are the things that might alert one to a child having taken something that you were not aware of, particularly if the child was well before. It's not like they've had a fever or a cold or a flu. If they're completely well and then suddenly they're very drowsy and off balance, start looking for what they might have taken that might not have been stored away safely.
Right. So let's maybe briefly speak about how some of these common ingestion cases could have been prevented. So what could viewers do to safeguard or better safeguard the access to those?
Yeah, thank you. I mean, prevention is always, by far, as we know, better than any other outcome. And it's tricky, in the holidays, I think people are out of their normal routine. Maybe there are visitors coming or staying with you, or you visiting other people. So one needs to be extra specially watchful during this holiday period. When it comes to medications, and I know this from my own experience, people come and stay, they're taking a lot of medications, they leave it at their bedside. So if you have small children in the house, please remind your visitors that their medications must be locked away or put up very high or absolutely out of reach of children. But that goes for ourselves as well. If we're traveling, we've got our medication in bags, be extra specially vigilant. Make sure there are child-proof containers if the medication has to be around. Make sure it is a childproof container so that children can't get into it. Same thing for cleaning products. While in this holiday time, be sure that your cleaning product cupboard, if possible, has a lock or is locked, or if you don't have a lock, put it high up on a shelf where children can't get. So putting things away immediately after use or after you've bought them, I think is a critical thing that we often forget. We've gone shopping, we put it on the table, and we forget that it's sitting there. So just be very careful on those packing away after use, keeping out of reach of children. The other thing that often happens, and again in the summertime it can happen, is that one buys a large container of paraffin or terps or whatever, there's a bit left over, and you pour it into an old cool drink bottle and leave it on a counter. Please be very careful. Don't decant any liquid out of its original bottle, or if you have to do that, mark the bottle clearly. Do not leave the Coke label or the Sprite or the whatever label on the bottle and put something that is not the cool drink in it. So we always say don't decant into other containers. When it comes to being outside, walking, going to the beach, we can talk a little bit about that. If one's walking in the lovely areas that we can walk in the Cape, especially in the afternoons, evenings, make sure your children are wearing shoes if they have, and socks, and be vigilant where you walk, because the snakes in particular are out and they don't want to bite us, but if we step on them or catch them unawares, then we at risk. Yeah. So wear shoes. If you're walking at night, have a torch, and in that way you can protect yourself a little bit. When it comes to going to the beach, if one gets a sting, one needs to rinse that area very well with seawater, not fresh water, because fresh water causes the sting to burst open, whereas seawater helps just to wash that sting off. So if it's a blue bottle or those kind of stings, wash it off with lots of seawater. Do not use meat tenderizer or urine or those things. And the next thing to do is to submerge that stung part of one's body in warm water. It really helps. It deactivates the sting for as long as possible, 20 minutes or so. That really helps to alleviate stings. So just for some first aid at the beach, remember those two tips.
Right.
Other things we can talk about, don't put things in handbags, etc. But I think we've covered quite a lot of those things. It's really about extra vigilance, especially during this holiday time.
Most people may not be familiar with, pediatric CPR or doing CPR. And you're quite right in saying that it is snake season right now, and extra vigilance needs to be had. What happens in the event of such a thing, apart from getting to the emergency room? What can you do?
In terms of what? In terms of a child?
It's like a snake bite or a snake bite or a spider bite, because they're going to be playing outside and they don't always keep their shoes on. So when something happens, what can the parents do?
Yeah. So spider bites are fortunately not normally life-threatening. They might cause severe pain, and it will be the same approach. Stay calm. For a spider bite, you could give some simple pain relief, like a paracetamol syrup, to the child, and then get to the hospital for that to be assessed. If you see the spider and can catch it without any harm, you can bring it along in a jar or take a photograph. So spiders are not too life-threatening or don't prevent. I mean, they may cause a lot of pain, but normally they're not life-threatening. In parts of the province and the country where there are scorpions, that can cause very severe pain. And again, there's nothing that one can do at home for that. One can try and put some ice on to help with pain relief. But again, you may well need assessment in hospital. So for a scorpion sting, as quietly and calmly as possible, get to the hospital. And again, if you can, I mean, often a scorpion is killed, then bring the scorpion with you,
to the hospital,
because that again helps us to identify.
Right.
For snakes, which are probably the most dangerous of our venomous creatures at this time of the year, same principles: stay calm. In terms of a child, step away from the snake. So if you can still see the snake, withdraw from the snake. Again, sometimes snakes are killed, in which case bring the body or bring a photo. It helps a lot. But if the snake has gone away, do not go after it, because one risks a second bite. So don't interfere with the snake if it's alive and has left the scene. In terms of the child, again, keep as calm as possible and limit their activity. The more we move, the more the snake venom gets absorbed and the quicker it gets absorbed. So regardless of the type of snake, rather don't let the bitten person run or walk, carry them. For a child, that's easy to do, and get to a hospital as soon as possible. Any hospital. Doesn't need to be a hospital where you think there might be antivenom. Snake bites and scorpion stings, and for spiders, we have antivenom available, but not for all, just for a few of the most dangerous species. But particularly for snakes, only about 10% of all snake bite patients require antivenom. So antivenom is not the first thing your patient needs. They need to be assessed and given support, whatever that is, be it oxygen or a drip with fluids. That's what they need. They don't need antivenom immediately. So that's not the reason, or you don't need to find a hospital with antivenom. Just go to your nearest hospital with an emergency department. And that is the best way to manage a snake bite case.
Right. Well, that I think brings us to the end of our first podcast. Thank you so much for your time, Dr. Stephen. We appreciate it. And for the rest of you who, if you have enjoyed or valued the content in this broadcast, please click like, share, and follow us. And if you see a donate button, hit that donate button. Because the work that we are doing here is important, and we can only do it with support from people like you. Thank you so much. Until next time, take care.
Thank you. Thanks, Jane. Bye-bye.